When someone suffers from heart disease or cancer or diabetes, they aren't told that there isn't a hospital bed or an outpatient facility. We talk freely and openly about our surgeries, our hip replacements, our knee replacements, and we even show off our scars. But rarely, if we ever, openly discuss an addiction or mental illness. And we certainly can see the scars of addiction. Substance abuse and mental health issues are as prevalent, as important, and should be treated the same as any other physical illness. We don't do that well enough. We don't do that nearly well enough. And it's time that we stop that practice. It's time that we recognize that people with an addiction suffer in the same manner as those with a physical illness.
It is taking the lives of residents in cities and in the suburbs, crossing socioeconomic lines and racial boundaries. It is devastating to families, some of whom you will hear from in a few moments. And it is devastating to loved ones and ruining countless lives. And we have to end this cycle of addiction, overdose, and death in our communities. And that's what we are here to try to start to do today.
On September 23rd, 2010, my family suffered the devastating loss of our son, Sal, to a heroin overdose. Sal was not only my son, he was also a devoted brother and a father. He was a beautiful soul who unfortunately did struggle with addiction. Sal struggled with the disease of addiction from his early teenage years, but he was never able to get the treatment he needed and deserved due to insurance barriers. Sal was left alone when he overdosed, but the person who was with him, he was not alone when he overdosed, the person who was with him left him alone to die, most likely for fear of arrest. So my son was left to die because someone was afraid to call 911 to save his life.
Benjamin Tawfiq Farrar is our son, our only child. On May 4th, 2013, at the age of 24, Ben was taken from us from the horrible disease of addiction. Ben succumbed to a lethal overdose of pencyclidine and heroin. We were devastated and have experienced a barrage of feelings spanning emotional, heartache, failure, and unfathomable loss. Ben's struggles began when he was arrested for selling marijuana to an undercover officer at the age of 18. From that day forward, Ben struggled with penalties and fines, police harassment, finding work, and getting into college.
Unfortunately, crime, addiction, incarceration, and death, they all go together. It's a pervasive problem that every single one of us in this room knows someone who's affected by it. This package that has been spearheaded by Senator Vitale, is going to be a model that should spread across the nation. And my hearts and prayers go out to all the families affected by substance abuse, addiction, and help is on the way for all of us.
We've been working and discussing these issues with the administration and with my colleagues and advocates, many of whom are in this room, on this package for more than a year and a half. Sometimes you can quickly respond to an issue through legislation with a quick fix. But with something as complex and tragic as this epidemic, we believe that it's important that we invest the time to ask the right questions and decide on the best course of action. It is necessary to combat this crisis with a greater urgency than that which is ruining or taking the lives of thousands of our citizens.